These are pretty good.
I can't believe you both know that I'm a registered dietitian. I'm coming on your show today to talk about prostate health, and both of you are eating these crackers and crap. No.
What's wrong with you?
What's wrong with you?
Just slap me.
Hey guys, Nick Drossos,
Dr. Andrew Steinberg.
and welcome to another episode of.
Have the balls to talk about it.
And this week our guest.
Tracy Satoff, registered dietitian.
Hi, guys.
Welcome.
Thank you for coming on the show.
My absolute pleasure.
So excited. In keeping with the theme of Movember, which it still is, we're going to talk about nutrition and prostate.
Well, I see you're trying to grow something. Is that for November?
I've been trying for a long time.
Okay.
Yeah.
Okay.
It's my
all right.
Movember.
Well, this is your month then. Maybe
Yes.
this month. Maybe if you eat these foods,
I will grow more hair, yes.
maybe you'll grow hair.
So tell us, what are these foods here? Why did you bring
So
them?
Movember is all about prostate health and men's health, and so we're talking about today is foods that can help either decrease your risk of getting prostate cancer, or if you actually have it or it runs in your family, which foods can you eat to decrease the chances, and actually foods that you shouldn't be eating that you don't get prostate cancer. So I brought a whole variety today. So we're gonna spin it and we can choose what we're gonna talk about it. So I'm in front of tofu. So actually tofu and soy products are very important for us to eat for our prostate health. You wanna eat that as a protein. You don't need to have fermented soy, because a lot of people today you hear about fermented foods like miso and tempeh. No, we can go with straight for tofu or soy milk. That's something that you can be having. So that could be for some of your proteins. We really want a plant-based diet when it comes to prostate health. So you can see also there's other foods.
Well, I have a couple of questions.
Go for it.
Because
Thank you.
you're showing the tofu and the soya, the whole idea of estrogen and for men.
Yes.
Like, I mean, I follow this stuff, and I hear men, well, you shouldn't drink soya. And then I watched a documentary that said it was false. So we're so mixed and confused. What's your take on this for men when you're saying it's good for prostate?
Are we going to grow
cancer?
breasts?
No.
Okay.
You will absolutely not grow with. And actually what's interesting, there's more hormones that you can find in like organic cow's milk than you will find in soy.
Okay.
And so they're not
Added hormones.
No, naturally
Natural?
producing hormones that cows have, because a lot of times if they use a pregnant cow
Right.
to produce milk, that's rapid growing hormones, and then yet we drink it.
Right.
And so that's why a lot of girls are getting, puberty a little bit earlier, and it's not added hormones, and it's even organic.
Wow.
And so there's more hormones than we think actually in cow's milk. So soy, which was something that we always thought of if someone has breast cancer or a hormonal cancer such as prostate, we should avoid soy products. But now we're learning actually, if you look at countries that diet is predominantly soy products, they actually have the least amount of prostate cancer. And rather when those men come and eat our diet, their prostate cancer increased significantly.
So the pendulum swings again, huh?
Yeah.
Yes. So soy and tofu is definitely something that you can have. But I used to also say the same thing. If you have breast cancer, don't eat soy. My son, I'd say don't eat so much soy. I don't want you to have man boobs.
How long ago did you change this? Like, I mean, you're like
My philosophies?
Yeah, or like what's
Driven,
the
because
studies
you know
shows
why?
recently.
It's because the plant-based diet is becoming so more predominant now. We have so many vegan alternatives. You have so many restaurants. So we have to learn and keep updated all the time. Nutrition is a constant science. That's the truth.
true.
Yep.
The same thing we say, don't eat eggs,
Yeah.
that sort of thing, cholesterol, saturated fat. So it's a constant evolution. And because people are eating more soy and stuff, we want to make sure that we're eating the proper foods.
One question: when you say plant-based diet, we're talking no meat at all. Cutting
No,
out
so if you wanted to do a plant-based diet, we're not doing any type of meat, no dairy
fish, no dairy
products,
products.
Count
none
me
of
out.
those.
I'm out.
Yeah, me too.
I tried it. To be honest with you, I tried it. I lasted for about 6 days.
I don't even
I
try.
was just, I was like,
I lasted for my salad. And when the steak came, I was
I always hungry after I eat vegetarian, but you should be eating vegetarian. It's very healthy for you.
Okay, spin the plate.
Okay, let's spin it some more.
next.
All right, so I'm gonna, even if it doesn't land on
Tomatoes.
I was gonna say tomatoes too. So actually, the reason why I actually chose these types of food here, because I wanted to make it very easy for guys. I wanted you guys to be able to go to the grocery store and pick up a pre-packaged, cut up fruits, vegetables, all these things that are easy to eat. So tomatoes have lycopene, and actually the most lycopene concentration is in the tomato paste and the tomato sauce, and when it's cooked. So that's an easy thing because guys can go ahead and have a whole grain pasta dinner with tomato sauce from a can, or adding the tomato paste, or eating straight tomatoes is also very good for the prostate. So lycopene is something that we're looking for. We're looking for cruciferous vegetables. So that's all my broccoli, my collard greens, cauliflower, those things. Those are very important to eat as well. And then we also want to try to get those whole grain products, right? So we really want to do like quinoa. And again, I wanted you guys to think about easy foods to have. So you can now go to the store and buy quinoa, ancient grains in a cup, 1 minute, and it's done. And there's no excuses why anybody shouldn't be eating.
So what is quinoa? What is this whole concept of ancient grains?
It's ancient grains. So the idea is that when you eat these kinds of grains, there's more fiber in it. And this is again what we want. We want the fiber, we want the antioxidants, we want the nutrients that's coming from the food versus anything white. So I'd say always to my clients, if you're going to choose anything, as long as there's color, that means it's going to have more nutrients. So if you can grab the ancient grains, the quinoa, those types of grains are very good for you rather than just grabbing something white.
So we're looking at these foods. These are obviously all healthy foods. Are these specifically for prostate, or is this just overall health? Like, is there a...
So it's all good for overall health,
Yeah.
but these are the specific ones that improve your PSA levels. With Andrew would know more than I would, but those increase make sure that your prostate is doing healthier. So these are specifically for healthy, but plant-based diets is for everybody. Increasing your diet full of antioxidants and nutrients is what we want to do to prevent any kind of health disease, right?
You talked about foods that we should be eating, and are there anything major that we shouldn't, aside from the obvious, that we shouldn't be eating?
So two things that are quite not obvious to not eat, is eggs, which now everyone loves eggs. We all love eggs, and eggs now we have omega-3 fatty acid eggs, we have organic eggs, we have free-range eggs, and I love eggs, and I would promote it all the time. However, we're noticing now that for men with prostate cancer, you want to avoid eggs because of the choline, and actually chicken too, which is so surprising because we all try to reinforce. I know.
Don't tell me no more chicken.
I know.
Letting
I
her
know.
back on the show.
But wait.
Yeah.
Is this to prevent? Like, I mean, is it
So
prevention
they
as
say
well?
that men who eat more eggs chances are you can get more prostate cancer.
What is more eggs?
So they say about 1 egg every 3 days. So it's
my
about
God.
2.5 to 3 eggs a week.
Like if I...
Is what?
I
But
like
egg whites are good.
I 2-3 a day.
Yes,
me too.
So you have to be careful of the choline because that could increase your
Let me check
chances.
your prostate.
You can do that in a
With all the
show.
eggs already do it, I'm like, it's wow, and we'd never think that.
No,
Is it white and the yellow or just
No,
both?
it's only in the yellow. The white is only the protein base. So if you
Right.
do egg whites, and then if you just have 1 egg and then 3 egg whites, that sort of thing, then that could be.
Because I
something.
remember that was the trend. Like, I mean, being a trainer, eat the white, don't eat the yellow.
That's
Then it was
right.
like the yellow's where the healthy
That's
is. Eat
right,
the
and
yellow.
the fat.
So
and
what is
amazing. This
what
goes
is
back and forth, the pendulum.
Like, what is from your experience? What is eat the whole egg? Both is
So
fine.
you can eat the white. The white is only protein. That's a
Yeah.
gimme, and that way you can even buy regular eggs. You don't have to buy all the fancy type of eggs. I still recommend omega-3 fatty acid eggs for everyone because then you're getting your good fat, which is quite hard to find, right? Unless I'm
Right.
finding it in my avocados or if I'm a fish eater or flax seeds, I'm going to be limited in my omega-3 fatty acids in foods. So I still recommend eggs, but we just have to keep an eye on it, especially if it runs in your history of your family of prostate because of the choline.
Wow.
And then the second thing that you're trying to avoid is actually dairy. And not just, people used to say low-fat dairy, or whole-fat dairy you have to be careful of. But now we're looking at the whole picture, and it's the hormones. So dairy products, even if it's low-fat, cheeses, yogurts, all those
All of
things.
it.
Right, so you can choose alternatives. Like we know that you can choose almond milk. You can choose also soy milk as well, and you can now buy like soy milk. You can buy coconut milk. You can buy oat milk, cashew, and all these yogurts.
Cashew-based cream cheese and tsatsiki and whatever.
Exactly.
Yeah.
So you don't have to. You could actually do a lot of non-dairy alternatives to avoid eating the calcium.
Do you when you follow your patients, you tell them no dairy?
if there's prostate in their family and if it's something they're concerned of and if they're over the age of 55, yes.
And if there's not, do you still?
No. So again, we have to understand that prostate cancer, and please correct me if I'm wrong, it's really for older men of 50 and above. So at that point, we should be careful of, although some studies are showing that even adolescent kids who are drinking like regular cow's
Yeah,
milk.
everything starts early on, for sure.
Yeah, so you just have to be wary of it. And I think actually the truth is that as long as you have, you know, a variety in your diet, everything in moderation, you know, again, your diet predominantly of full of those antioxidants of fruits and vegetables, I think that you don't have to worry.
And is there a recommended?
As much as you can.
much as you can.
You know, I could say 6 to 7 fruits and
Yeah,
vegetables a day. I could tell you to make sure all your grains are whole grain, you know, but as
Red
much
meat?
as... But you see, again, the
it's
same
all-
thing. It's those red meat and saturated fat, Atkins followers.
Yeah.
All those things are saying that it's not really good for the prostate. And we want to make sure that prostate's working
What,
healthy.
what part of it is not, like when we look at meat, is it what they
It's the
inject it
saturated
with?
fat.
Is everything?
It's the
If you're
saturated
eating
fats.
organic meat,
It still has saturated fats.
the same thing.
It's
Are
not
there,
necessarily...
Is there steroids in
No.
meat?
So there would be, there's pesticides, there's hormones and stuff predominantly. That would be the meat industry because
Right.
they want to make sure the cows and everyone or the meat is bigger
But
and
if you buy it
stronger.
organic, because I was
So
yesterday
they-
at the
right.
and I saw organic.
So
and I'm like,
organic is also a better choice, especially for men's health and testicular cancer, because we want to avoid all the toxins, right?
Right.
So again, I'd say eat organic,
Okay.
and a good way to eat organic is doing, you know, the Clean 15 or the Dirty Dozen, and that refers to fruits and vegetables. So the Clean 15 would be foods that you can go ahead and are the cleanest that you can buy, and it doesn't have to be organic. So that's usually things with peels, because the pesticides aren't in. But then there's fruits and vegetables that are more porous, such as strawberries and stuff. So that way the pesticides sneak in, and apples also keep the pesticides in. So there's the Clean 15 and the Dirty Dozen, and you always want to, in that case, buy organic, or if not local foods to avoid all the pesticides and stuff
Specifically on the Dirty Dozen.
like that. Yeah.
Okay. Got it. Great. I learned
Now
a
you
lot.
still
I
want to
learned a
check?
lot, and I'm depressed now. I'm
No, all these
I'm
are
going to
make
check
us-
my prostate.
This also decreases your anxiety, decreases depression.
It's interesting because when we look at, you know, eating healthy, I guess it's pretty simple when we think about it. It's having the willpower to stick to it. And I guess when you eat healthy, your whole body technically should function.
But
I mean, all the studies are showing that, right? Like when men go from eating a westernized diet of high saturated fat, high processed fats, processed foods, fast foods, and then they switch to this diet,
Yeah, when
all
they-
their
when
levels
they
change.
move to North America, when diets change to the North American diet, they fall into the same disease patterns as
Americans,
Americans,
Canadians, obesity. Obesity is the other thing that you have to be careful of. You know, so it's also overall lifestyle.
Yeah.
We also want to encourage people to exercise and, you know, every day have some sort of physical activity, little
So
things.
eat well, got to exercise, you got to have your prostate checked.
And guys, I want to thank you guys for watching. Make sure to subscribe, to hit the bell.
Have the avocado to talk about it.
Have the avocado to talk about it, as well as go check out our podcast now available. We'll put the link in the comment box. Tracy, thank you for coming on the show
Anytime, boys.
and for having the
Yay.
Balls to talk about it.